Good evening and welcome to a Be Informed session. My name is Karl Buhariwala and I founded Be Informed to help people make good decisions. Today we are joined by Niyati Dhavale, an art therapist who will be providing a seminar on a guide to art therapy. Before we proceed, I would like to acknowledge the traditional owners of the lands on which we're meeting today and pay my respects to their elders, past and present. This session is being recorded and will be made available to you and everyone else on our YouTube channel following today's session. I would like to acknowledge that this session is being recorded in Australia. However, Niyati is based in India at this point in time, and the content and matter being presented today is of a general nature only and doesn't constitute any specific health or wellbeing advice. Following the seminar, which will take around 25 minutes, there will be Q&A. So if you have any questions, you can submit those through the chat function directly to myself as the host, and I will then relay them to Niyati for her to answer. And following today's session, there will be a one-page handout which will be distributed by email to registered participants. So you can keep that as a handy reference and share that with family and friends. So those are the housekeeping matters. We can now get straight into it, I think. So Niyati, if you're ready, I'll pass on to you.
Yes, thank you, Carl. Thank you, Carl, for the introduction, and thank you each one of you for being here. Let's begin. Now, to understand about art therapy, we first need to talk about our familiarity with art. All right, where do I know art from? Where have I heard about art or seen about art, right? So, for example, for almost all of us, it has happened in our childhood through painting, drawing, coloring, even playing in sand, etc. Right? But know that visuals or images are part of our very early experiences, right from infancy, when our vision of the physical eyes is being developed. We are trying to figuring out the shapes, the colors, the hues, the light, everything. Yes. However, our understanding of art as an expressive medium, as a medium to communicate, even as a tool for healing, inner healing, it goes really further back in ancient times. For example, you may have seen some carvings on stone, or you may have seen some sculptures that depict, particular events. Even when you go to museums, we see a lot of paintings telling us stories from ancient times, right? Now that we see that idea of art making, as a way to heal, as a way to express, to communicate, tell stories, express our inner states, it's very old. But the field of art therapy is relatively young and is constantly being evolved. Okay, so just to quickly give you guys an idea, a background of what art therapy and how it started being used in psychiatric field. Let's say it started during 1876 to 1888. There was a French psychiatrist called Paul Max-Simon. He's also known as father of art and psychiatry. So what he did, he published a huge collection of paintings made by his mental health patients. Now, there was another psychiatrist during 1920s, Hans Prinzhorn, who followed that trend. He collected again the paintings, the drawings made during therapy sessions with the mental health patients. And what they did, they really studied the art, the pictures that were drawn by the mental health patients. What was drawn in those paintings were the inner experiences of those patients, inner feelings of those patients. And many a times, the psychological distress was very, very evident in those images as well. Carl, we can go to the slide one, please. Thank you. So this is what we are talking about, that this interest in studying mental health patients and their drawings, basically the art that was created by them, it kind of led to using of art as a medium for diagnostic and evaluation purpose in psychology, right? For example, the very famous test, psychological evaluative test that most of us have heard about, is very, very popular, and is one of the major breakthrough in projective tests, is called Rorschach ink blot test, in which patients are shown pictures of some ink blots, and the patient responds, the client responds with whatever association that they can draw from that picture, right? Um, Again, such ink blot tests were not only used for mental health patients, but they were also used for now they are also used in very industrial setup where there are interviews, assessments happen to learn about personality of the prospective candidate as well. The another very famous, very commonly used test is house tree person test, where a lot of expression from within and some of the interpretations, projections are used. Okay, but look, however, not all the psychiatrists, all the psychologists were interested in using art medium as a test, to really know what is wrong or what is the issue, what is the troubling factors. But most of the psychologists, psychiatrists in the later years, say during 1940s, 1950s, they were more interested in using art for therapy purpose also, right? There were a lot of such psychologists like Carl Jung, Carl Rogers, the pioneer and the guiding force of bringing art into psychiatry, Margaret Norman. All of these professionals really promoted kind of a marriage of art and psychotherapy. So art psychotherapy, right? So what we know today of art therapy is, in its simplified essence, and also in an attempt to define what art therapy is to simply put it as using art making processes or art expressions in a very formal, therapeutic, mainly counseling setup, right? Now, psychology has been interested, if you will look at the field of psychology, it's always interested in expression of human feelings, expression of the thoughts, the conflicts that an individual goes on a regular basis in their daily life, probably, right? Uh, of course, it also involves a lot of complex, difficult, even sordid individuals, right? And that's why, using art making, like coloring, drawing, painting, even using of clay movement, as we will see in the further slides, what are the ways in which art can be involved in psychotherapy or in a therapeutic setup. What it does, this art expression, it allows the flow of your energy. It allows a very authentic expression of your own self, your own experiences, or your own deep feelings and thoughts, right? And that's why art is not only restricted to be used in a therapy setting, but as you can see in this slide and in this figure, art can be used in two forms: art as a therapy and art in therapy. Now, these two are very different things, right? And to understand this difference is also very, very important, right? Um, Now, when art is used for personal satisfaction, for personal use, or just as a hobby, or you know, in a very non-therapy group, like you may have heard of art classes or paint and sip events, right? Where you use art for just satisfaction of your creation, or even as a skill, to build up, to become an artist. That is what we call art as therapy. More majorly, the individuals who are using art as therapy, they can do it by themselves in their own setup, or like I said, with a non-therapy group, right? However, when art making and the art medium is used in a very formal therapy setup, which is again facilitated or in the presence of a trained, certified art therapist, who also can be a mental health professional. That is when art unfolds in therapy, right? Now, um, we have been talking about free flowing, expression, authentic expression. You will ask me that the question is, why is it necessary to have this free flowing expression? Why is it necessary to express even, Note that all the researchers, especially in psychiatry, not just mental health, disorders or illnesses, but also also physical disorders, physical diseases happen because this flow of energy, this expression is blocked, okay, or is hindered, or is met with some sort of an obstacle, right? That's why therapy space, especially in counseling, being a being a counselor, I can share that with you. Counseling therapy space is that space where this it's very non-judgmental, where there is openness, there is certified person, there is a trained person, a psychologist or a counselor who's there to guide you, who's there to be with you, even in your difficult moments or in your difficult experiences, right? And to have that kind of strong rapport, a chance to communicate, your deepest difficult emotions or thoughts or conflicts for that matter, is definitely the best deal, right? That's why as an art therapist and a counselor, I always encourage art in therapy. We have a lot of artists as well come to us to really improve their practice of art, to improve their expression, basically, right? Now, next slide. Now, we have spoken and understood a little bit about what art therapy is in a very simplified manner, right? Uh, we will now look at the neuroscientific perspective of art therapy, right? Um, when art making is used, there are a lot of senses that it involves, right? That's why if you will see if you'll see in the first in the slide, in the first statement, we are calling art therapy as very restorative, integrative, and transformative experience, right? Now let's do a simple experiment. All right, a simple exercise. What I'll do, I would ask you all to close your eyes and now think of an apple, the fruit apple. All right. Now, when you're thinking of the fruit apple, think of the color, texture of the apple. Think of the shape of the apple, right? Take, take 10 seconds and think of an apple, right? Now, I'm so sure many of you may have imagined an apple as a red apple, you know. For some of you, uh, I'm also sure you may have experienced or you may have imagined it as a green apple, a small baby apple, maybe, right? For some of you, you may have seen it fresh from the tree. For some of you, I'm sure you may have seen the picture of an apple, the image of an apple on a can of apple juice, maybe, right? Now, do you see what is this? This is called associations, right? So, in a very simplified words, these are the associations we have already made in our brain with certain type of words, concepts, fruits, colors, and these associations later on form memories, right? Now, where are these associations happening? Of course, in our brain. Yes. So to use like a neurological term, and to more simplify it, this is what we call creation of neural pathways, right? When two things are associated, say a red apple fresh from the tree, some of us may even have had the taste of the sweet apple in our mouths, right? That's memory. That's the neural pathway that was already created when maybe whenever you had that experience of eating a sweet apple. Yes. Now, here comes, all right, we will now talk about an experience which I had in my therapy. Um, in my counseling process with an 8-year-old boy who was referred to me with anger issues. All right. And the major concern for um, his parents and also teachers were that he would hit his classmates. Right. Now, in the session, so what we are talking about, the art therapy session, in the session, what we did, um, we draw a body image outline, and then we spoke about where the anger was stored in the body. All right. And the boy said, it is in my left hand. All right. Um, and as it was observed, yes, he did use a lot of his left hand to hit his classmates. All right. Now, when we used art therapy, with images and everything, what we did, we used a very neutral body image cutout. It wasn't his picture, it was just neutral body image cutout, who had anger issues, and then we spoke about it. What the boy did later is that he turned that body image into a robot. Yes. And what he draw was the robot's left hand. He colored it with color red, just to represent his anger. Yes. What he did next was amazing, that he gave a name to robot. He called it I don't remember the particular name, but he explained it to me that it was one of from the Transformers movie, right? So the idea of the robot was to take the anger from the left hand, process in his chest, and then what comes out of right hand was in pink color, which was a concept of peace, which came out was calmness, good words, even for the other person, for his classmate. So the processing in the chest meant, as we, took this further in the session with psychoeducation, with counseling, we kind of spoke about what does this processing of anger would look like, maybe tapping on the heart just to calm yourself, or probably think of something good in the other person, or even to focus on breathing, so that was the processing for that child, right? And and he was very, very committed to using this robot, and the whole process from left hand processing the anger, and then from the right hand getting out the calmness and peace. He was very committed to use that, and when he did that, within 2 months time, we got really positive feedback from the parents, from the teacher, and in fact it was observed that the child had developed social skills and really had developed good deep friendships with his classmates. And he continued using art, in therapy like this. So this kind of miracle is very very specific example of what we call as transformative aspect of using art. So art is not just limited to drawing or painting, but when you see that when it happened in a therapeutic process, in a therapeutic setting, there was a chance to communicate what was coming out. There was a chance to um, talk about possible changes or the ways in which we could do the change. And that's why art in therapy, with presence of a certified therapist, is very, very beneficial, right? Now, when we talk about neuroplasticity, again, it's the same process about when we are making the formations, when we are making associations. Now, why is this important, this concept, especially how art plays a very crucial and very healing part, is if you look at a lot of trauma and recovery research in mental health field especially, it is observed that traumatic events, traumatic memories are stored in the body, not just in sensations, but also majorly in form of visual images as pictures. And that's what we call the memories. If you will, so when it's observed that when a person is going through the traumatic distress or has been triggered by unpleasant memory, for example, it's been observed that the part of the brain which stores images gets activated, but also uh, such people really find it hard, very difficult to express what's happening to them in words. Words really fall short to express the distress, emotional pain in that time, in such times. And that's where art therapy really, really does its work, the healing integrative aspect of it. So when we talk about increased serotonin levels in brain, what does it mean? So when art therapy has been used with patients of depression, even anxiety for that matter, the mere function, the mere result of creation of something, uh, that really helps in the feelings of happiness, that really helps feelings of good self-esteem as well, you know, and that in turn really helps in increase of hormones like serotonin, which gives us good feelings, basically, right? So this was in very, very short. What I've tried is to give you a snippet of how this fusion of evidence-based psychotherapy, you know, and art therapy, and also the neurobiological framework behind it happens and works out, right? Next slide, please. All right. So now let's talk really about the techniques. Yes. So we have spoken, till now we have spoken and have had an understanding into what art therapy is, right? It talks about the art making processes. There are some techniques in art which are used in therapy setting with a certified therapist, right? Um, and the techniques that we are going to talk about now, uh, what I would like to definitely share and provide a disclaimer that they are very general techniques, right? Um, maybe some of you may benefit, some of you may need some more guidance, may need some more direction with certain techniques. And by any ways, I would also recommend that if you have any physical or psychological, conditions that may require medical help and may require further counseling, um, please, I encourage you to seek the right help. And like I again said, that these techniques are very general and can be used by each one of you, right? Now, before we kind of jump on to what are the techniques, I always believe about creating the right environment. Yes. For any work that you do, There need to be a right environment, a right time, even the right space, right resources. Yes. So let's talk just briefly about that. Yes. It is very important and necessary for us to have that knowledge and attention, how we are creating that environment, so that, like, for example, setting up your space. By environment, we mean setting up your space, where you may find very, very minimal disturbance. You have a platform or at least some space on which you can work, on which you can make the art, basically. Yes. Um, Also, there is sufficient light. Yes. Some people prefer chair and table. Some people prefer sitting on the floor. Whatever suits, whatever suits, whatever is comfortable. So second is time. Now, time, what does it mean? For any technique, for any skill to work, you need practice. You need to commit some certain amount of time. Yes. I would definitely encourage use of art every day, if possible, or use of art minimum or at least twice or once a week. Yes, because that's going to help you really understand and give you some results. So time is very, very crucial. Choosing certain amount of time really would help you. Regularity will not mean every day. Regularity will mean, if I'm deciding giving half an hour every week, that's good enough in itself. Yeah. Now let's talk a little bit about materials as well. Materials, what does it mean? The type of paper, the texture of the paper, or the kind of colors that you're using. Like, for example, very, very important. And I really want to, one of my mission is to educate also in art therapy about this concept of environment, space, and especially materials. Because what happens many a times when we talk about art materials, the first thing comes to our mind would be colors, watercolors, acrylic colors, or something like that, canvas, anything. But look, for each and every person, connect to materials very differently, right? Like for some people, watercolors, now for me particularly, I love watercolors. Yes, I love the flow of it, the less control, of the flow, of the water, or of the color there is on the paper. I enjoy that. Yes. However, for some people, like for people with conditions like obsessive compulsive disorders, for example, they may have, or they may struggle with use of such medium of watercolors. For some people, they really like using pastel colors or the chalk or even the sketch pens. So you really, really need to kind of experiment and try out different materials. Yes, and whichever suits you the best, I would encourage that use for you, right? So let's move on. Again, the second point in this slide is very, very important, because what we are going to do is we are going to, I'll just quickly read and explain to you. The very, very first step, if you have to practice art therapy, is practicing relaxation. Just be relaxed. Yes. Relaxation doesn't mean that uh you have to meditate and all of that. It's just very simple. Sit comfortably, loosen your body, just continue to breathe normally, listen to the voices around, just feel the temperature in the room, and just be yourself, right? Just take a deep breath, just focus on your breath. That's it. That's how you could just relax. Yes. Now, again, you have to practice this. Yeah. The next exercise that I would again encourage each one of you to follow and practice at least weekly once is building the awareness, right? Art and therapy is all about awareness. right? Bringing into awareness something that has been unconscious, that has been into your subconscious, right? So, for example, a very simple exercise, collect few images or objects around you, So, for example, I'm collecting this, I'm just picking up this pen, I'm noticing its shape, it's cylindrical, I'm noticing its color, it's blue, um, you know, and now I'm thinking about a phrase or a word that comes to my mind when I look at this, and this blue reminds me of ocean, for example. The happy memories it brings, the ocean, the color brings, so this is the regular practice. What it will help is for you to get acclimatized to different colors, different shades, different textures, right? And within that practice will emerge your style of art. Within that practice will emerge the mediums you want to use, the way you want to use your art. Yes? All right. Next slide. Now let's quickly look at some of the techniques that I personally use in my art therapy sessions, or even for myself, when I'm doing art as therapy. Yes, the first is mandala drawing. Mandala drawing is a very ancient technique used by Buddhist monks, creating circular figures and putting in patterns, beautiful patterns, But what it does, it represents life. It represents self. Yes. One of the very famous and very effective psychologist Carl Jung. He used a lot, psychotherapist who used a lot of this mandala art for himself, during his life crisis or times when he really wanted to get in touch with himself, touch within our own self, right? So mandala is really helps in times of crisis, or when a person is having physical, psychological struggle. There are a lot of conflicts, and wish to better understand themselves. So these feelings of wholeness and integration is the part of mandala drawing. Um, it's very, very transformative art. I personally use a lot of mandala art for myself, and it has given me a lot of calmness, a lot of peace in my life. Yes. The second one is neurographic art. Now, again, neurographic art is a mixture of drawing lines. It could be straight lines or wavy lines, curves, and those intersections, basically using a lot of colors in those intersections, using a lot of patterns also in those intersections, really has proven to help a lot of people to deal with their anxiety or deal with any kind of stress response. So neurographic art is also a very, very popular art technique, very safe to use as well. Next is abstract imagery. Uh, One of my favorite and has really many benefits using the abstract images, abstract image making. A lot of people have, like it's written, they have found a lot of help to develop insight, uh, looking at problems in a different ways, because with abstract images, there is no, uh, you know, no associate, there is a free association, chance of free association. Next is mindfulness. Again, mindfulness would involve certain techniques like meditation, becoming aware of your whole body and whole senses, aware of your emotions. The very principle of using mindfulness uh, is principle of here and now. In the present moment. It can also be used, and it is encouraged to use to to maintain the well-being emotionally, physically as well, right? To build awareness also. Now, next is clay and sculpture. Again, an effective, very, very popular, especially amongst children. When we are working with children, clay sculpture, use of sand therapy also really helps the very young children to develop their sensory motor skills. But again, clay is very effective in anger management. Um, Also, it is very useful for people with anxiety, or sometimes when people feel very stuck in their life. You can definitely use clay to give a structure, to give a um, defined image, that really helps. Again, all of this is actually the magic of using art in therapy, or art as therapy as well, both of it. Yes. uh, the way art works is in itself, it integrates what is in your subconscious. It brings out through these activities and works itself out. Yes. The other art-based techniques that are used very commonly and very popularly is movement, drama, music, very expressive tools. Um, very expressive tools, especially when also works while helping children. But if you will, there are a lot of adults who also use dance, who use movements, for dealing with traumas, recovering from traumas, especially in patients with depressive tendencies. Movement really, the music, the drama, this kind of approach in art really helps. Uh, really helps. Yes. So if you will look at these are all, again, like I said, a form or a medium of using art. Yes. uh, the art in itself allows the expression, and any activity that allows expression, authentic expression, will always be very healing experience. Yes. Now, next slide. All right. So we come to the last slide, which talks a little bit about what would be the scope of art therapy, but also the limitations, right? When talking about really the limitations, I would personally say there are none. But for some people, again, it is the kind of therapy that you want to prefer, basically, right? For some people, verbal counseling, talk therapy, that helps, right? But for some people, art therapy, really works out well, and it is the recent trend also. So it's really depend on the type of therapy that you prefer. But in my experience in this field now for around 11, 12 years, that what I found is that, art, when used in therapy, along with verbal counseling, really has a profound effect and gives a very quick recovery, results, basically, for the clients as well, right? Second is principle of time and change. Again, like any other therapy, counseling therapy, even like, for example, when you're exercising, building up muscles, it is it is a it principle of time and change. It takes time. It takes time to change. It takes time to explore. It takes time to modify, certain patterns, certain um, behaviors, certain habits. Okay, so it is basically about time and change. Yes. um, Again, time, effort, and commitment on part of the client, very important when we are using any therapy for that matter. Yes. Now, again, when we talk about the scope of art therapy, you know a very popular, very famous art therapist, Kathy Malchiori, she talks about art making can initiate a positive transformation by self-exploration and self-understanding. So you can I would highly recommend you to get this book and read this book. There are a lot of more techniques in this book as well. Yes. uh, and art therapy actually can be used by any professional, really, because um, what I want to kind of leave you with in this session is this affirmation. I really want you to have this affirmation that the purpose of art, okay, is not to create great art, okay, it's not to create amazing painting, Yes, but it is in a simplest sense to allow that expression, allow that free flow of your energy, free flow of your self-expression, you know, and that in itself, is the urge for every human, if you really look at it. And look, art making is available for all age groups in all capacities. Yes. um, and I really, really hope for each one of you, and I really wish that this session really kind of encourage you and motivates you, or at least struck a chord, um, that you might really give it a chance, give it a go to use art in your daily life in whichever way you can. um, and the last reminder, whatever art you make, whatever art you do store it, make an art journal, keep it with you. You never know what will come out and what will help you, right? With this, I thank you all for joining me in this session. Handing over back to Carl. Thank you.
Thank you, Niyati. That was a very thorough introduction to art therapy. So I'm sure those that have attended today will have taken away a lot of information.
I hope so too.
It was a very, very good seminar. So Niyati's details are on screen. So if you do wish to contact her in relation to art therapy, feel free to engage with her directly. So we'll now move on to Q&A. And just as a reminder, this session is being recorded. So if you do have to leave for whatever reason, you can still watch the entire session, including the Q&A on the YouTube channel once the recording gets uploaded. And as a reminder, the one-page handout that Niyati has prepared will be shared with all registered participants following the session. All right, so before we get into the questions that we've received during the session, we'll start off those that we've received ahead of the session. So the first question, Niyati, is just around art therapy in itself and being an art therapist. What did you have to go through to become an art therapist? Or is it a certification or a process that you have to qualify for?
Yes, definitely. Thank you for that question. So I had been working as a mental health counselor already. For art, to become a trained and certified art therapist, I did a 2-year diploma course with CCAT. It's called College for Educational and um, College for Educational and Clinical Art Therapy by Robert Gray. Um, he's an amazing teacher, very experiential, and with a lot of wisdom of 30 years. And I have been lucky to have him as my teacher for art therapy. So yes, there are different ways in which you can become an art therapist, right? So one is, I've given you my path. I did my diploma, and then uh, years of work as an art therapist. For some people, some of my classmates, course mates, they had done their bachelor's in arts, then masters in arts, and then so there are the few ways like this. There are a few universities also who provide masters of art therapy, so that can be looked on. Yeah.
Thank you. The next question that we've got is in relation to using art therapy in the professional workplace setting. So can you use it for improving, team collaboration, leadership, those sorts of aspects in the workplace?
Absolutely, absolutely. We have used art therapy, especially in group setting, where we focus on the communication patterns, especially within the groups, building up of altruism also in the group. But also, like I mentioned, one of the techniques that we usually use, mostly use, is using art therapy for goal setting, for finding that one goal within the group or even for individual purpose. But yes, art therapy can be successfully used in group setting in a very formal, businesses, formal institutions. Yeah.
Thank you. And We had a question in relation to the art component. So, what happens if you have a client or someone that you're working with that doesn't appreciate art or like that sort of
Mhm.
technique in dealing with their emotional issues? How do you go about encouraging them to embrace that method to help them with their health and well-being?
Right. Very, very, very good question. I really like this question because, yes, you're right. Not, like I said, not everyone is up for, or happy to use art in the therapy or really keen on using it. But look, art therapy being such a dynamic, creative field in itself, there are a lot of ways in which you can incorporate art. Even, for example, when we are um, solving a problem, we are thinking creatively, right? But yes, when we are talking about a particular client who doesn't like art, um, it's okay. You cannot really force on the client that you have to use art, but you can always give them the chance to use art, in the therapy basically. And I would, always get their consent before using the art.
Yeah. And actually, you touched on one point in relation to using art to explore the creativity. One person has
Mhm.
asked, is art therapy similar to sort of design thinking in the sort of the problem solving space?
Mhm.
Have you come across that sort of connection before between the two streams?
Yes. So, really, yes, that's again a very good question because you're very, very right. When we talk about creativity, because of our experience, in the past about what creativity is basically, uh, generally we talk about designs, creativity, we talk about, using particular color combinations maybe. But yes, it is used for problem solving as well, with particular techniques, for example, uh, because what we are doing when we are using art in therapy, we are not really looking at from an artistic point of view. We do not want the patient, the clients to make it a good, beautiful drawing. But what happens in the process is what is unconscious to you, what is in your subconscious, which is not really known or we are aware of, it comes out. Yes. And that's why presence of a trained therapist, art therapist is very, very important because the therapist will facilitate the guidance, facilitate or give some prompts uh, about a problem solving or some questions like that, right? So the client actually knows the answer, they know the problem solving design or whatever it is. It's just the facilitation of the whole process. Does it answer the question though?
Yeah, yeah, I think it does. I
Mhm.
think it can be used across multiple disciplines to address, their exploration of issues and how they go about resolving those. Um, now, jumping to the question we received during the session. So the first one's in
Mhm.
relation to, and I think it would be good just to clear off any doubt. Um, Art therapy of itself is, I guess, not used to treat or prevent any sort of more sort of an aid or a tool. So from a clinical point of view, Niyati, can it be
Yes.
used to diagnose and do other sorts of things that are of a clinical nature? I guess the answer is no, but just would like to get your thoughts.
Yes. Yes. So look, art, particularly has been, like I said, has been used in psychotherapy and in psychiatric fields for evaluation, for diagnosis as well. However, if you really look at such tests, okay, we always need to understand, and as a client also, you have to ask about the reliability of the test. What is the validity? What is the reliability of the test, right? And uh, in my personal opinion, this is completely my professional opinion. Um, when you are trying to interpret or when you are trying to evaluate based on what the client has created, there are almost 99.99%, there is a chance of projecting what the therapist is seeing, in that drawing. There are likely chances that the projection would happen from the therapist or the person who is evaluating, conducting the test from their point, right? So I would not only rely, if I have to do a psychological evaluation, I will not only rely on art as a medium to do the evaluation or clinical assessment, right? There are a lot of so it again kind of brings us to the field of the assessment, psychological evaluation. So going to a proper, psychologist and doing a set of tests is always important.
Thank you. We've received a question in relation to whether we get a certificate for attending today's session. The answer is no. This session is of general information only. It's not affiliated with any course syllabus or university degree sort of curricula. So yeah, that's just there will be no certificates provided. The next question that we've got, Niyati, for yourself is in relation to the art therapy techniques. And when you engage with a client or a patient, not sure what you call them, but because a client, and they need your help, how do you provided the 6 or so techniques, and I'm sure there's many others as well. How do you go about choosing the most appropriate ones based on the program of work that you will engage with them? Like, what process, at a high level, of course, do you go through to apply the best techniques to help your client
Right.
deal with their situation?
Very, very good question. And like in any therapy session, even the therapy session for that matter, if I am using CBT, cognitive behavior therapy, it will be modified for each client according to their need for the counseling. When it comes to choosing the art therapy techniques, we always would start from what is the problem, what is the concern, what is the issue at hand, and then whatever comes out, from that picture is what will be, what kind of guides us to the technique, like I again said, uh, the techniques of art therapy are really are very varied, but the base of any art therapy technique is allowing the self-expression. That is the basic principle or a rule of any art therapy is giving the client space to express how did they feel about the issue, how or what are the thoughts or conflicting thoughts of that issue or whatever it is, right? So the prompts what the art therapist use or the direction that the client wants to go in, the techniques are based on that. For example, um, the one example that I shared in the session also for a boy, but the other one I'll share with a school student, a girl, 14 years, teenager. And as she was going through a lot of emotional turbulence, turmoil at that point of time, particularly because there were a lot of family issues, family conflicts. And what we observed that she was not able to really express what she was feeling in words, right? When we used again, it's again about experimenting and trialing and what the client feels comfortable with. When we asked her to just to now simplify, I'm giving an example, to draw a house, for example, she was not able to do it. Then we took another route, but still used art, is using the abstract art, and that's where the tables turn. She was really able to use abstract art, use a lot of colors, movement in the drawing and everything, and was able to really, by end of 6 sessions, around 4 to 6 sessions, she was able to really express what she was feeling. Because what happened, what was inside, what was in this unconscious, was coming out on a piece of paper, right? It wasn't, she was getting conscious of what she was really, really feeling. And she gained a lot of clarity into her own emotions. So, okay, so just to short this again, the techniques will depend on what the client really needs in that session. Yeah.
Thank you. And that is an extension of that question in relation to individuals that are in mental health units, whether it be inpatient, outpatient type arrangements, right? What techniques do you suggest might be most appropriate for those in sort of the more acute, mental health situations? Do you have any
Okay.
sort of thoughts around that?
Um, I don't think of any particular techniques, but I cannot like really suggest or recommend any particular techniques
Yes,
like
it's
to
depending on the
generalize.
well, yeah,
Yes, but again, like I said, art therapy again is one discipline, okay, one part of the treatment for that patients, right? Um, the conventional treatment would be with medication, with you know, again with counseling and all of that. But yes, what I would recommend is use of paper, colors, you know, getting them the access to express themselves, like acrylic canvas painting, and you will see there are a lot of hospitals who do, give access for patients to use art. There is an hour, every week where patients would gather together and just use art. Yes, but that would be more of art as therapy, because what patients are doing, they're doing something for themselves in those moments. Yeah, there is
and
not like a particular technique. It's just making the art materials accessible
yeah, and I guess it's very
and
circumstantial
just
as well, depending on the nature of the client situation. And
definitely.
another question that we've received is in relation to training. How much training do you think is recommended before someone practicing this space? So, falling short of actually getting a qualification,
Mhm.
how much sort of how much should they embrace, I guess, the discipline before they can sort of be able to hold themselves out as being someone that's committed to, supporting someone
Right,
through.
right. So look, as with any education or the course and the requirements, once you do you know even the certification. Now I can only talk about myself. When I did my diploma, I did my certification, um, and the diploma, once you because it's an extensive training, um, I would encourage to get a lot of supervision sessions within art therapy, with a qualified supervisor and art therapist, basically getting a lot of supervisions in the initial stages really helps. Having that mentor, um, having to really talk about your practice as an art therapist, that really helps. So I would highly encourage a lot of supervision in the initial phases. And if you have an existing client base, you can start using it as you're learning also about art therapy, right? But again, yes, the proper certification is really necessary, because when you give yourself that much time to really learn, to gain the knowledge, it really, really helps. It will make you a good therapist, because we need good therapists.
Thank you. And our final question is more general in nature.
Yeah.
Do you see the use of art therapy increasing nowadays? Given you've maybe had the pandemic, there's been a lot of I guess individuals that have gone through tough times and the like. Have you seen
Mhm.
sort of an uptick since the past few years with people coming to you for help and are using art therapy as a way to sort of navigate their emotional struggles and self-awareness?
Right. I'm really glad, Carl, that you asked this question, because it actually gives us an idea now that yes, the very conventional therapies like talk therapy or verbal counseling, um, many times I feel find people who want something more, in counseling space. They are getting more aware now because of the social media also, about counseling, using counseling. It's not just limited to people with severe complexities or anything like that. Even people with general eye distress, they want and they seek counseling basically. And when it comes to using art in therapy, people are really welcome. It's a very fresh, change to them, just to, be able to express their deepest, strongest feelings without using, limitation of words, basically. So yes, I've seen people actually are opting for art therapy. There is definitely a fresh, perspective to that in the therapy. Um, and the results, like I said, I have found in my therapy work, the results are quite miraculous and quite quick, and that's what people want. Very quick, you know, process, very quick work, you know, even with mental health for that matter.
Thank you. It's been a great session, Niyati. Thank you for taking the time to provide everyone with a guide to art therapy. So again, Niyati's details are on screen. So if you do wish to engage with her, ask her any questions, feel free to send your requests or your queries directly through to her. So that brings us to the end of the session. Thank you all for attending. Well, as a reminder, the recording of this session will be uploaded to our YouTube channel, so you can share it with friends and family or revisit any part of it that you missed or would like to go over again. The one-page handout that Niyati's prepared will be sent through to all registered participants following the session, so you'll have a document handy which you can refer to in the future and share with your family and friends as well. Please do follow us on the social media sites there. We do rely on word of mouth, as I fund this myself, and this is a totally not-for-profit enterprise that has no private or public affiliation whatsoever other than myself. My goal is just to help people make good decisions through the sharing of information. The next session is on the 27th of September. It will be on purchasing your investment or principal place of residence. So it'll go through key things you should be aware of when you're buying a property from a finance and engagement perspective when you are looking to buy property in Australia. So hopefully, if you are interested in that one, you'll consider joining that session and participating in the seminar. So that brings us to the end. Thank you again, Niyati, for your time, and wishing
Thank you,
everyone
Carl.
a pleasant evening. Bye for now.
Bye.